Thank you, Alan Molina, for the invitation. Yeah, I think Dr. Park was a great segue. He proved once again that you're not supposed to mess with the pancreas, even in simulation. And we might not be hitting it out of the park, but maybe mental rehearsal is a way to help do that. So some of this work I'm going to talk about was funded through an in-house grant through the Academy for Advancement. It's an educational enhancement grant, and I am a co-editor for Simulation Radiology. It's a book. We're not going to talk about radiology today, so. The goal of this talk for me is to promote the incorporation of mental rehearsal into simulation-based training to expedite learning and skill acquisition. Three major objectives. One, I'm going to review the current theory related to mental rehearsal, including key features for maximizing its effectiveness. Then I'm going to compare and contrast the use of mental rehearsal for skills acquisition in non-surgical settings, and then finally discuss current applications of it in surgical simulation-based training. But first, Dr. Shalata was talking about engagement, so I'm going to try to engage y'all. It's Jazz Fest next week down in New Orleans, so I have pictures of three things. I was fortunate enough to go to Camden Yards, one of the temples of modern baseball stadiums. So I have the Rebirth brass band there. Actually, it's a New Birth brass band playing at Jazz Fest last year. I have some surgeons working in the operating room, and then I have the Orioles doing well on Tuesday night. So what do these three things have in common? We've got musicians, we've got sportsmen, and we have surgeons. What's the commonality between the three? Rehearsal. I hear rehearsal, I hear teams. So I would contend that success at what you do is 90% mental. So we're going to talk a little bit about mental rehearsal and how that can lead to success. But first, what are some key features about mental rehearsal? Well, before I go on, let's talk, just a quick review. Fitz Posner, I'm sure, again, everybody in here is an educator. They probably are familiar with this whole idea of the three-stage theory of motor skills acquisition, where you start with cognition. You try to understand the task. It's very erratic. You need explanation and demonstration. You go into integration of the task, where you comprehend and perform the mechanics. You do deliberate practice. You become more fluid. And finally, you get to automation, where it just happens and it's like riding a bike. There's other ways to look at this. And the phases that happen of this, when you do this learning, there's a fast phase that happens immediately after the training. There's a consolidation phase that happens about 6 hours after the first training, and then you get into a slower phase where you get further gains from more training sessions. Finally, you get to that automatic phase, and then finally retention, again, is like, it's just like riding a bike. You get back on it, it's all there, and you can execute the task without, in absence, without much difficulty. So how do you get motor learning? Well, there are several ways to do it. One is through active observation. If you observe someone doing a task that you're trying to learn, say suturing, it's been shown to be an effective way to enhance performance of a particular motor skill. And what it's been shown to do is recruit areas of the brain involved in motor skills. So it actually recruits those areas. When you're observing that person do it, it recruits the areas that are going to perform that skill. Motor imagery is another way, and that's basically mental rehearsal. We'll talk a little bit more about that, but that leads to improvement of motor tasks as well for targeted tasks, and it has the same sort of recruitment. So when you do mental rehearsal, you're recruiting in the motor area of your brain those neurons. So there are lots of different names for mental rehearsal. It's basically just a cognitive rehearsal of a task. My favorite of those is imagery practice. I think that's just an elegant way of saying it. How does it work? Well, Feltz and Lander in, I believe it was 83, they did a systematic review, and they found that it was more cognitive related tasks rather than motor skill, just thinking about motor skill, were more effective with mental rehearsal. And they hypothesized that was because these cognitive symbolic elements of a task facilitate the motor acquisition. So if you have to involve thinking about the tasks or doing more thought process about doing it rather than just a simple motor task, that it was more effective. And Suin expanded on that, and he came up with this theory that you actually, when tasks involve high cognitive requirements, you have to do a lot of thinking about doing the task, that you go through this strategic planning, and that's what helps enhance the acquisition. This is a great systematic review that just came out by Schuster, and basically what the group did is they looked at 5 disciplines. You can see them listed there. Those are the number of articles they, through their process of the systematic review, they looked at in each, and they used this, it's PETLEP parameters to look at the methods and modes of mental rehearsal within it. Now, one thing I want to emphasize is when we're talking about teaching lap chole, we're not talking about medicine. We're talking about education, because that falls under education. Actually, one of those education articles was a lap chole instruction course. So what are characteristics? So she went through this, did this huge systematic, that group did it. They went through it. What did they find? Well, what's important from a physical and environmental standpoint, another location in the patient's position, it's being task specific, making it task specific as opposed to not task specific. More importantly, I think, motor focused activities were more effective. So if you did a motor focused mental rehearsal, it was more effective than non. And then if you placed it after physical practice, it tended to be more effective. And if it was added to the physical practice, not necessarily embedded within it, but added to it, it was more effective. In terms of learning, being there and as a live person, giving detailed instructions verbally was more effective than giving pre-recorded instructions or video instructions. Then also supervising the practice, but not directing it, but supervising it, having the person go through it in a non-directed area, but under supervision, having standardized instructions, not tailored instructions for the individual. And then it was interesting to me that people who did not have familiarization, like they didn't get like a little tutelage into mental rehearsal techniques before doing this, they actually had the mental rehearsal be more effective. So what are some characteristics, the final characteristics? And I think these are the most important. If you're going to take them home, these are one. Individual is better than group. Having the person's eyes closed worked better than having them open. And then an internal perspective, that means they are thinking of it from their mind's eye. They're not watching themselves do it. That's an external perspective, but they're feeling themselves do it was more effective. They recommended no more than 2 mental rehearsal trials per minute. So if you're doing repetitive mental rehearsals, you're not supposed to do more than 2 a minute, and not more than 3 sessions per week. Because if you did more than that, it wasn't as effective. And then those were the averages for the effective ones. What was interesting, there were some differences they noticed based on discipline, and I would emphasize, looking at the education one, it tended to be before physical practice, and that worked well, and it tended to be directed and cognitive in task relation, and that, for education, worked. So let's talk really quickly about mental rehearsal non-surgical settings. Well, in sports, it's probably one of the best known ones. You have these elite athletes going through it. There are various types of imagery you can use. And you can see you can do cognitive specific, cognitive general. Cognitive specific is learning how to throw a ball. That's mainly for a novice. Novices go through that process. Cognitive general is learning how to link all your tasks together. It'd be like I'm from New Orleans, so Drew Brees going over his game plan. So that would be for advanced athletes. And then they have motivational ones. And motivational specific, which I found was really interesting in this article, they said that, you say if you're a golfer or if you're a person and you say, I do tennis, so let's say I imagine winning Wimbledon. People who do that, they tend to increase their goals, they set higher goals, and they tend to practice more. So that it just motivates you by going through that process, which I thought was very interesting. This was another interesting one. There's a lot of graphs here, but basically they looked at scuba divers and gymnasts, novices and experts. And what you see is on the left-hand side there, you see expert divers, and then you see novice divers right next to them. And what you notice is those bars are different. It's basically recruiting different areas of the brain based on whether you're a novice or you're an expert. And the thought is that what happens when you become an expert is you actually you're honing is the blueprint of where all the neurons are to fire. You're not necessarily going through that skill and that motor task, but you're honing the blueprint so you can fire it right away. And you're doing a higher level cognitive aspect. It's been used in other disciplines, physical therapy, post-stroke victims, and it's been shown to have positive results. And in music, you can do it what they call offline, where you think and hear the music, or you do it online when you're actually doing it and you anticipate the next notes. And virtuosos can anticipate the next notes and go through incredible variations by doing that. And I thought that quote was very good. This was a person who's in the Chicago Philharmonic, and he basically said, if I don't hear it or conceptualize it, I can't get it, I can't play it. So what about in surgery? Well, from technical skills, the group at Imperial College has done great work for mental imagery and mental practice. Sonal Aurora and that group did lap chole training. They show that people who did mental practice before doing a lap chole on a virtual reality machine performed better than controls who did not. It's been shown in basic open skills that this was for medical students randomized. These are both randomized studies working on a rabbit, doing a performance on a rabbit. People who did the imagery practice actually did better than people who did not. They've done it for simulation-based training for cricothyroidotomy in ENT, and they showed again that if you add mental imagery, mental rehearsal, that you have better performance. How about non-technical skills? Well, that's a little mixed. This was a study that was done with anesthesia residents, and some of them went through mental rehearsal about crisis management, and some of them did not. They went through a simulated crisis, and they did not find, looking at objective measures, they did not find a difference between the two. So they said, well, it's maybe not that great. But if you look again, Imperial College created this stress management program, and it had several aspects, as you can see, of mental rehearsal in there. And what they found is it did improve skills. And so by doing that, they felt that it was very worthwhile. Real quick, what we've done at LSU. So what we looked at is we looked at mental rehearsal, if there's a correlation between the type of simulator you used. And we did it, step-by-step verbal recitation so we could make sure they're doing it right from start to finish. And then we went to the simulators. We used the Imperial College Mental Imagery Questionnaire. We measured objective data on the simulators, the two different types of simulators. And then we did Pearson correlations. Our groups were about even it wasn't randomized, it was purposely divided according to PGY level. And what we found was, in terms of the mental imagery questionnaire, in terms of visual imagery knowledge and confidence levels, we had improvement, so we showed that it was working. The simulator data was less exciting, but we did show that on certain tasks that we had improvement in time. And we did show a correlation between mental rehearsal. There was a negative correlation. So they did mental rehearsal, and the more they improved on that, on the questionnaire, the better they performed, the faster they performed. But it was small. We didn't do proficiency training. There were lots of limitations. And I think the reason why this one worked is it was probably the best one to technically a motor skill you could really visualize because it was a two-handed cut and clip. So in conclusion, mental rehearsal is an effective modality for teaching both open skills and minimally invasive technical skills. Its effective characteristics include individual supervised, non-directed instruction with an internal perspective. And you can incorporate it into a simulation-based residency curricula. And it has, I think, potential for expediting acquisition of skills and maybe hitting it out of the ballpark like they did last night with a walk-off grand slam instead of just having a single. So thank you very much.